So this morning, we want to help you understand how to reduce your risk of breast cancer. 1 in 8 women will be diagnosed with cancer this year. And there are risk factors that you can't change. Age, we can't stop that, can we? Gender, genetics, and family history. But there are certain steps that you can take to mitigate those factors. Dr. Scot Ackerman, the medical director of Ackerman Cancer Center, is joining us this morning to explain those to you. Good morning, Doc. Thanks for being here. Do appreciate it.
Thank you.
Breast Cancer Awareness Month. This gives us an opportunity to focus specifically on breast cancer. Of course, with as many women that we have watching, this is important information for them. So let's start with reducing the risk. First and foremost, limit hormones and birth control. I've heard this before.
So there's two issues. One is birth control pills and one is hormone replacement therapy for postmenopausal women. So birth control pills has been conflicting reports over the years. Early reports show that birth control pills increase your risk for breast cancer. Some more recent reports show a decrease your risk for breast cancer. Also, whether it increases or decreases your risk of ovarian cancer varies by study that's done. But the bottom line is probably to minimize your use of birth control pills, and that certainly when you're a young woman, you take birth control pills if you want to as a way of birth control. But it's been shown that 10 years after the completion of taking birth control pills, your risk of getting breast cancer is normal. It goes back to what it would be had you never taken birth control pills.
So even if you do use that as your form of birth control, there is a way to mitigate it because 10 years after, then the chances...
Right, yeah, and your risk of breast cancer goes up as you get into your 40s and 50s. So if you took birth control pills in your 20s and 30s and then stopped, your risk goes down to normal at the time that you would normally peak in risk of developing breast cancer.
And there are other options that you have to just explore with your OBGYN also to reduce that risk.
But also hormones, the postmenopausal women.
Oh, yeah.
That's the real issue, is that estrogen replacement therapy, hormone replacement therapy, that women who take estrogen have an increased risk of breast cancer. It's usually a breast cancer that's not very aggressive, but still you want to try to limit hormone replacement therapy because that'll increase your risk of breast cancer.
Worth a conversation with your doctor, without a doubt. Maintaining a healthy diet. We hear this not just in terms of reducing the risk of any kinds of cancers, but just, heart disease as well. I mean, because the reality is you are what you eat.
Right, and the American Cancer Society now really is focusing on diet and exercise because a lot of the other factors that cause cancer have been mitigated to a great extent. Pollution, environmental exposure, that sort of thing. And so we're focusing now on diet and exercise, and women who are obese have a higher incidence of breast cancer. Women who are sedentary, who sit all day at a desk, have a higher incidence of breast cancer. Women that don't move around during the day have a higher incidence of breast cancer. So you want to have a healthy diet and have exercise. The two go hand in hand. To have a good body mass index, have an ideal body mass index, those women have a lower risk of breast cancer than women who are obese or overweight.
And it's interesting because there was the American Cancer Society study that found that women who spent 6 hours or more each day sitting had a 10% greater risk.
Right.
So even if you have to work at an office, I sit a lot, in the newsroom, just get up, walk around, and really try to stretch your legs. Last point, being diligent about a breast cancer screening, getting those mammograms every year, and as you get older, maybe more than once a year.
No, as you get older, maybe less than once a year. So the guidelines have changed a bit.
Okay.
The American Cancer Society and the U.S. Preventive Services Task Force have both changed guidelines a little bit to maybe do it a little bit less often than we used to. I still recommend a baseline mammogram when you're 40, and then between the ages of 40 and 55, annual mammograms. After the age of 55, have a discussion with your physician about having maybe a mammogram every other year. Okay. Many times mammograms will find things that really aren't real, and that'll cause a lot of anxiety. I still like every year as a recommendation because I find that with my patients, if you recommend every year, not everybody's compliant. So you're lucky if you get every other year. Yeah. So that's why it's a slippery slope to not recommend it annually, because I think once we start recommending it every other year, we'll maybe be lucky if we get every third year. So at age 40, a baseline, annually after that, you can consider maybe less than annually after the age of 55.
Dr. Scot Ackerman, thank you very much for being here. Do appreciate it.